I'm Natasha Kavanagh for Dubai Life TV, and I'm here today at the American Hospital where I'm joined by ER physician Dr. Colin Bullard. Dr. Collins, nice to meet you.
Nice to meet you too.
Dr. Bullard, tell me a bit about your career to date.
After leaving high school in the Bahamas, I went to university in Canada and I graduated with a Bachelor of Science degree from Mount Allison University. I was fortunate enough to get a position here at the American Hospital in Dubai, and so I came here. This is my second year now, and I've been fortunate enough to work in the emergency room here as an emergency room physician.
With regards to your role, talk me through what happens when a patient walks into the ER room on any given day.
You know, one of the things the American Hospital, is proud of is being JCI accredited. And
what does that mean?
So with the Joint Commission International Accreditation, it's an international accreditation body based out of the United States that sets standards for medical practice. And there are a lot of standards that are set up for the emergency rooms. And like other JCI accredited facilities, when a patient first presents to the emergency room, they have to be triaged first. And what triage means is to sort patients out into those patients that are very serious and need to be seen immediately, as opposed to those patients who are, minor cases that can wait to be seen.
So do you get many trauma patients through to the emergency room?
Yes, we do. Although major trauma patients, are better served by going to a trauma center, we still do get a lot of trauma. Not the major traumas that need to be taken directly to the operating theater. We get the more stable trauma patients, and there are quite a few of them. And we have a lot of all the various specialties.
And that's all available here at the
So that's all
American
available
Hospital.
here at the hospital, and it is a multidisciplinary approach. Not only do we want to save life and limb, but we want to try and get the best possible outcome for the patients in the long run.
Do you get many patients through in need of emergency cardiac care?
We get a lot of cardiac patients. People coming in with chest pain, shortness of breath, dizziness. These are all symptoms that could be cardiac related. And so we get a lot of patients presenting that way. And so we need to make sure, first and foremost, they're not having a heart attack or some other cardiac or respiratory emergency. And so those patients, we have to do a thorough evaluation for in the emergency room. We have a very good cardiac team with several cardiologists. And we have a cardiac catheterization lab that's available 24 hours.
As an ER physician then, what's the most challenging part of your job?
Well, the emergency room is a critical care area. And so sometimes we do get very sick patients. And some of those patients sometimes do die. And so one of the hardest things is, having to manage a patient that's that ill that they're not going to survive, that they die, and then we have to, discuss this with their families. We often need like a critical incident stress debriefing after such a case. So, that's probably the most challenging cases that we do have to manage.
What's your favorite thing about your job?
I say the favorite thing is, I do like, taking care of children. As well. So we do see a lot of pediatric emergency cases, and it's always good when a child comes in and not feeling well, and then by the time as they leave the emergency department, they're all energized and running up and down, and thanking everybody and playing with everybody. So that's probably the most rewarding part of the job.
As an ER physician, what advice would you give to the people of Dubai?
Well, one of the things that's bothered me driving around in Dubai is I see a lot of families driving around with their children not in their car seats. Child restraints are extremely important.
Great advice. Really good advice.
Thank you. Thank you.
Dr. Bullard, thank you so much. It's been a pleasure to meet you today.
You're welcome.